Hello and welcome. My name is Dr. Riham Nassar. I'm a specialist clinical pharmacist. Today we will talk about atrial fibrillation. So let's start our lecture for today. Atrial fibrillation is a heart condition that causes an irregular and often abnormally fast heart rate. A normal heart rate should be regular and between 60 and 100 beats per minute at rest. In atrial fibrillation, the heart rate is irregular and can sometimes be very fast. In some cases, it can be considerably higher than 100 beats per minute. Symptoms of atrial fibrillation can cause problems including dizziness, shortness of breath, and tiredness. Noticeable heart palpitations, where heart feels like it's pounding, fluttering, or beating irregularly, often for a few seconds or in some cases a few minutes. Sometimes atrial fibrillation does not cause any symptoms, and the person who has it is completely unaware that their heart rate is irregular. So what causes atrial fibrillation? When the heart beats normally, its muscular walls tightens and squeeze to force blood out and around the body. They then relax so the heart can fill with blood again. This process is repeated every time the heart beats. In atrial fibrillation, the heart's upper chambers, atria, contract randomly and sometimes so fast that the heart muscle cannot relax properly between contractions. This reduces the heart's efficiency and performance. Atrial fibrillation happens when abnormal electrical impulses suddenly start firing in the atria. These impulses override the heart's natural pacemaker, which can no longer control the rhythm of the heart. This causes to have highly irregular pulse rate. The cause is not fully understood, but it tends to affect certain groups of people, such as older people, people who has long-term conditions as heart disease, high blood pressure, or obesity. Atrial fibrillation is more likely to occur in people with other conditions such as hypertension, atherosclerosis, or heart valve problems. So, what are the medications that treat atrial fibrillation? First, we have blood thinners, as for example, apixaban, aspirin, dabigatran, enoxaparin, heparin, rivaroxaban, and warfarin. Next, we have heart rate medicines. The most common way to treat atrial fibrillation is with drugs that control heartbeat, as for example, beta blockers, for example as atenolol, bisoprolol, carvedilol, and metoprolol. Another one we have calcium channel blockers. They slow the heart rate and tune down contractions, as for example, diltiazem and verapamil. Finally, we have heart rhythm medicines. They slow the electrical signals to bring heartbeat into what's called normal sinus rhythm. These treatments are sometimes called chemical cardioversion. We have sodium channel blockers and potassium channel blockers. Sodium channel blockers, which slow heart's ability to conduct electricity, as flecainide, propafenone, and quinidine. Potassium channel blockers, which slow the electrical signals that causes atrial fibrillation, such as amiodarone and sotalol. Other management as cardiac ablation, where the area inside the heart that's causing the abnormal heart rhythm is destroyed using radiofrequency energy. Afterwards, the patient may then need to have a pacemaker fitted to help heart beat regularly. Now we have case presentation of atrial fibrillation. 78 years old patient complaining of fatigue, dizziness, and chest pain during his weekly run. The patient exhibits these symptoms periodically in his recent past 2 morning jog sessions. Thinking it was due to dehydration, he drank water after each episode but found no relief. He says he has considerable fitness and he enjoys running, swimming 2 hours every morning. His family has no history of heart disease but has a history of hypertension. The vitals taken upon visits are blood pressure, systolic 160 and diastolic 92, heart rate 128, irregular, which is greater than 100 beats per minute, respiration rate 17 part per million, lung decreased lung sounds. Additional findings we have there were swelling of feet. CBC and urine analysis has no abnormalities. TSH and T4 levels were normal. ECG results indicate irregular heartbeat. Echocardiogram results shows blood pooling in atria, improper blood flow. Chest X-ray indication of possible fluid found in lungs. Based on history, chief complaint, and findings from the examination, we can find this case shows atrial fibrillation. Thank you so much for watching.